Welcome to Workforce Central, the official podcast of the National Association of Workforce Boards. Stay tuned as we explore the latest resources, thoughts, and trends in workforce development. And now, here's your host, Ron Painter.
This is Workforce Central, the official podcast of the National Association of Workforce Boards from Washington, D.C. I'm your host, Ron Painter. Doug Foresta is at the controls. And it's a pleasure for me to welcome Will Davis, manager of BayCare Health Center.
BayCare Health System in Tampa Bay.
All right. And Kristin Dailey from the CareerSource Pinellas County in Florida. Welcome.
Thank you.
Thank you.
We're coming to you from Forum 2016, hosted by the National Association of Workforce Boards. And BayCare has been awarded will be. We're recording before the actual presentation, but trust me, Will, I saw the award is there. The 2016 W.O. Lawton Business Leadership Award, and we've honored some interesting companies over the years. Let me ask an intro question. Tell me a little bit about BayCare, and then Kristin, tell me a little bit about CareerSource Pinellas.
BayCare is the second largest private employer in the Tampa Bay, Florida area. We have 14 hospitals, 300 different access points. We believe that we ought to be the healthcare provider of choice for the area from birth to end of life. We believe that we ought to cover everything, and we provide services in nearly every area of life, from urgent care centers to physician centers. Again, 300 plus access points across the Bay Area. And the current workforce is 25,000 team members that we have. Most of them would be clinical because of our business. And so nurses and laboratory and all of those types of careers that you have there. And then we have a number of other professionals that help run the business of BayCare. And so from finance to electricians to everything. I mean, we really have it all. We're kind of an entity all unto ourselves. We do it all.
Wow. Kristin, tell me a little bit locate for us where CareerSource Pinellas is.
CareerSource Pinellas, the best way I can describe it is if you know Clearwater Beach or St. Petersburg, you're right in the heart of Pinellas County. We're right in the middle of the state. We're that little thing kind of hanging right off the middle there. And we're surrounded by water. Because of the size of the population, we are our own workforce board. The county itself is a one-county workforce board. Well over 1 million people in Pinellas County. We serve a couple 100,000 a year.
Wow. Well, 300 access points. What happens at an access point?
Well, an access point would be any of those service lines. So we have physician offices, we have laboratories, we have urgent care centers. Again, any diagnostic centers, ambulatory centers, surgical centers. If you need the service provided and it's healthcare, we have that. We have long-term care facilities. We have behavioral health facilities. We really do have it all. And so we're a one-stop shop for healthcare in the Tampa Bay area.
And your title is Manager of Workforce Development. Yeah, so how did this come about with BayCare? This is somebody called a workforce development manager been there a while, or is this something that
I've been with BayCare for 5 years personally, but we've been doing so the words have been changing, right? So we were education, and then we became workforce development, and actually in the last 6 months we've now become organizational development and learning. So it's more than just developing the individual, it's developing the entire organization, and by doing that you obviously have to start with the individual. So we're doing that. We're looking at strategic goals of the organization, strategic needs of the organization. And a lot of times that comes down to who do you hire, how do you hire them, and then what do you do once you've got them hired? And so we're looking at that. What do we do before we get them, once we get them and onboard them, and then how do we maintain the relationship with them? And we actually have a new goal of how to be the happiest place on earth to work. That's actually one of our strategic goals, which is very unique for a healthcare system.
We've had the happiness folks here, James White Kim, a couple of years ago. Tell me about the numbers that they're going to read tonight when they present BayCare. Though the award, frankly, to me, are pretty big numbers. I mean, this is recognizing 650 individuals received training, 140 new nurses, and BayCare committing a $4.5 million match to what Kristin, you all at CareerSource were able to bring in through H-1B funding. I mean, that's staggering.
Well, we believe that one way or the other, we're going to have to pay for this. So if you follow the logic, if we don't have the in one way or another, we're going to have to pay for this. If we don't have the employee there to provide the service, then we're not going to get paid for the service. So if we don't have someone to do that procedure, then we're not going to get paid for that procedure. So we have to look at it the other way. We need to develop the person, and we already have them. We have 25,000 to choose from. Let's pick somebody. Let's pick the known. Let's pick what we have, and let's develop them so that we have somebody to do that procedure so that we can be paid for that procedure. So I won't say it's selfish, but in some sort it's selfish. We're going to pay for it one way or the other. We're either going to pay for it by not being able to provide the service because we don't have the people to do it, or we're going to pay for it by educating those people. So one way or the other, we're going to pay for it. We might as well make the best decision and pay for it up front and get the better investment in the long end.
Kristin, from being a former director, I hate to say being an old director, that sort of may apply, but it doesn't sound great. Being a former director, what's it like to find a company like BayCare that puts their money on the table as you were trying to do the H-1B?
Not only with the H-1B, and our relationship really goes back well over a decade with BayCare. So when we were given the opportunity to apply for the H-1B, we knew that BayCare would step up. As Will mentioned, they are very big into investing into their staff, and they project out into the future of what they are going to need. They're proactive. They're not reactive. So when we saw the opportunity, they're really the first ones we called and said, "Are you in on this?" And they said, "Absolutely." And so then we wrote the grant, we were awarded, and the numbers they speak for themselves.
So it's been part of your philosophy as Pinellas, and I know Ed Peachy, who couldn't join us. I know Ed really firmly believes in those kind of partnerships. It's just business outreach. It's the business connection long before you really need that partnership. It's building that relationship.
Yes, it's building that relationship. We have a number of programs beside this grant that BayCare participates with us. They've been participated in our employed worker training. They've participated on our on-the-job training programs. Back when there were ERA funds, they actually were one of the key employers that were getting people back to work.
Oh, great. Well, tell me about BayCare's other involvement. You're involved deeply in the community. You mentioned you've either got to find or make the employees that you need, or you're not in business. Well, what's that look like for BayCare?
As the second largest employer in the Bay Area, we have an obligation to our community. We're community owned because we're nonprofit. And being nonprofit, part of our mission is to provide the best healthcare that we can for the community. So when we make money, the misnomer is as a nonprofit, you don't make money. Well, that couldn't be further from the truth. We do make money, but what do we do with that money is the difference. We reinvest it in our facilities. I mean, we have to make money or we don't exist as a company. There's got to be a bottom line.
Yeah, that's right.
You have to have the finances to fulfill the mission. So we do, and we do very well. We're a very stable, AA rated financial institution, one of only 2 healthcare systems in the state of Florida with that rating, that high of a rating, which means that we have the funding to then turn around and reinvest it in our facilities. And what's also important is with 25,000 team members, think of how many families that is. For me, I'm one team member, but I'm 6 people with my family that my company touches. So it's not just my employer, it's my healthcare of choice as well. So that's why we really have to make sure that we're investing, because the people we're investing in are not just our employees, they're our customers, they're our patients as well. I have family in our hospitals and I go to our labs and I see our doctors. So the investment really, when you look at it, it makes a lot of sense. I'm building the best healthcare for me. Really.
That's an interesting way. I hadn't thought about it looking at it that way, but building it for yourself. You've changed your title to organizational development. Does that reflect? I know that you guys are very involved in continuing education and getting employees to think about what's the next piece of education. Is that reflective in changing the title?
I think it's more strategic, to be honest with you. As Kristin said, we've spent a decade looking ahead, but it's been very narrow, honestly, in the focus. So we all know we need nurses, but who doesn't need nurses? So that was easy, right? That's easy picking. We're starting to go after the things that are really hard at this point. Adding medical lab tech programs that not just we need, but everybody in the community needs. So we've engaged a school through CareerSource's help with an additional grant that we've applied for. We're engaging the local partners educationally, saying this is what we need. We have some funding for it. We need you to implement this program, and this is how we need you to do it. And by the way, we'll help pay for some of it. We'll give you rotation space. But it's that triangle that we've had to create. And I say we because it's been all of us. It's been the education institutions that are willing to do what they have to do. It's been CareerSource as a funding source and as a development partner. And then it's been us as a business putting our money where our mouth is and saying we need help, and we're willing to fund to get the help we need.
It's a great partnership, obviously, which is why we're honoring it. I guess I'd ask whichever one of you wants to take this first. So when we walk into a clinic or we walk into the hospital, we see the doctor, we see the nurse. But as you mentioned, there's all kinds of people that support that. Kristin, how hard is it to get young people to think about being a lab tech? That's not 4 years. That's sometime after high school. But how hard is it to get young people to think about these technical careers?
One thing the healthcare industry I think has done well is actually promote the type of careers. And also one thing that the healthcare industry has that a lot of other industries don't have is a very clearly defined ladder. I can come in as a CNA. I can come in as a lab tech. In our centers, we are constantly promoting healthcare opportunities. We do assist in our centers with training individuals. So we have a regional targeted occupations list, which all different healthcare professions are on. But we show them, hey, if you start here, then you can go to the next step and the next step. And once they enter BayCare's door, they almost take care of that for us. So they may start off as, a patient care tech. And when they hear of BayCare's program about them paying for their nursing degree at their facility using their staff, they're sold. And I know Will can testify that they've had people that have started as patient care techs that have gone to RNs to BSNs to instructors. There's been drivers, a number of different transport drivers that have been going through the program to become registered nurses. We're really excited to be a part of that, and we'll continue to do so.
Well, it sounds like it's not just a program, it's a culture at BayCare. What would you tell a company? What kind of advice would you give a company that's looking and thinking they need to really get actively involved in their own destiny? What are some of the lessons that you would point at?
You have to start with relationship. And so that's what we've done. We have a relationship with CareerSource. That relationship is that when they see something come across their desk, they say, wait a minute, this looks like BayCare. Let's call them. And it happens with our education institutions. We know the names. We talk on the phone with the leaders of our educational institutions, the assistant superintendents of the school districts that run the high school programs. We talk to them. We know who they are. It helps being an employer of choice in the area because we are the second leading private employer in the area just in terms of size. So if you have some momentum like that or can get a group of people together that can create the momentum, you need to drive the educational experience of your area. So instead of education saying this is what you need, the workforce needs to turn around and say, no, this is what we need. And they need to start telling them that and say, and if you change it, we'll help finance it. It's got to be money driven. It has to be. And you have to have CEOs and boards that are willing to say, we're going to spend the money. No one wants to do that. But if you manage yourself, and BayCare's done this, to their credit, our financial minds have done this. We've put ourselves in a financial position where we don't have to decide between paychecks and tuition reimbursements. Last year alone, we provided $5 million in tuition reimbursements for our team members to go back to school. What other company is doing that type of work? And so we're excited to be part of that. And when you tell the stories of people that started in the program at an entry-level minimum wage job and are now instructors at the college teaching the new minimum wage people that are coming, That's what this program is about. That's the full circle of this program.
That's kind of fun to watch, Kristin, both from the standpoint of some of those people probably walked through your door trying to figure out, now what do I do with my life, to Will, when you saw them move up.
Right. And just even the retention rate that BayCare has, we're proud to be a part of the programs and fund those programs when the retention rate, I know Will can speak to it, on the programs where they actually have assisted with putting them through the school, they have much higher retention rate than just hiring those who come out, have graduated from the outside. And I know Will has...
That's a great point. Will, do you see this in retention when you're talking to your colleagues in other areas? Do you see the difference in your retention because of these investments?
We're doing some things as well. There has to be some accountability on the part of the worker. So we do have some policies and programs in place to say, if we invest in you, we expect a return from you. So some of that has to do with the fact that if I'm going to pay for your schooling, I expect you to stay for a certain amount of time. I expect you to reinvest back in our company. But what we find is that's really the exception. To be honest with you, we have far fewer people that leave or don't fulfill their work agreements than we do that stay. And our most recent information on those hired as recent as 2014 out of this particular program, we have 12 and 13 percentage points higher of a retention rate of those that came to the program versus those that were just, I call them hired off the street, even though some of them had actually put themselves through school and actually did the same program just at the college and not with us. And so they looked identical on paper, but they didn't even stay as long. So it's really fascinating to see the retention rate. And many of them moving into becoming CN3s, which is actually a management position, and becoming assistant nurse managers and nurse managers. That's exciting to see that happening.
Kristin, Dailey, thanks for taking time out and sitting down and joining us.
Thank you for having
Will
me.
Davis from BayCare, congratulations on the 2016 Lawton Award, and thanks for what you do.
Thank you.
You've been listening to Workforce Central, the official podcast of the National Association of Workforce Boards from Washington, D.C. I'm your host, Ron Painter, and we will see you again soon.